Contact tracing is still a major challenge, derailing Kenya's fight against COVID-19. Health Chief Administrative Secretary Dr. Rashid Aman acknowledges the country cannot determine the exact number of infections, confirming concerns by the World Health Organization, which says the curve is not flattening as perceived. The revelation comes as the country confirmed 114 new coronavirus cases with no death reported in the last 24 hours. Purity Musa with that report.
On Monday, the World Health Organization (WHO) faulted Kenya's testing strategy for COVID-19, saying it has been focused on low-risk groups. In a statement, the United Nations International Public Health Agency further cautioned against interpretation of the drop in COVID-19 cases in the country to mean decline in the spread of the disease. A day later, the Ministry of Health confirmed contact tracing, especially in the capital city, Nairobi, is a headache.
There has been a challenge in contact tracing, particularly in specific localities, especially in some of the hotspots, like Nairobi County being one of those hotspot areas. If you will recall that as this pandemic and the numbers started growing in the country, and you begin to pick up more and more positive cases, equally then the network of contacts becomes almost an exponential number.
This perhaps explains the decline in confirmed cases lately. In the last 24 hours, 114 Kenyans tested positive for the novel coronavirus from 1,682 samples.
114 people have tested positive, bringing to 34,315 the number of confirmed positive cases. From the cases, all are Kenyans except one foreigner. 93 of them are male and 21 are female. The youngest is a 1-year-old infant. The oldest is 85.
So far, Nairobi has the highest number of infections at 19,494, followed by Kiambu with 2,524 cases. Mombasa is third with 2,387 cases, followed by Kajiado, which has 1,878. In Machakos, 1,246 people have tested positive for coronavirus, while Busia, which is ranked 6th, has 1,087 confirmed cases.
318 patients have recovered from the disease. 263 of them have been released from home-based care program, and 55 have been discharged from various health facilities where they were receiving care. The total recoveries now stands at 20,211.
Meanwhile, Kenya is among selected countries in sub-Saharan Africa, South America and North America that will participate in a new study dubbed COVID-PN 5001, aimed at making researchers understand the novel coronavirus better and possibly come up with a vaccine. Dr. Grace Mboya, a researcher at the Kenya Medical Research Institute, says 800 respondents from the 3 regions will participate.
Hii study itafuatilia walioambukizwa na COVID-19, wale ambao wasio na dalili yoyote, wale ambao wako na dalili ya chini, na wale kikundi cha mwisho ni wale walioathirika zaidi na COVID-19 na waliolazwa hospitalini.
With the schools expected to reopen in January, the Minister of Health says it is not clear whether children will remain asymptomatic to COVID-19 disease or even become the super spreaders. Purity Museo, Channel 1 News, Nairobi.